I knew chemo was going to be ending in the middle of June, and my faithful Dr. McCluskey said, "We're going to have this radiation talk." I said, I know. And I said, "You know how I feel about this. You know I'm a tree hugger. You know where I am coming from. I like to do things a natural approach." I said, "Surgery I was okay with. Chemo, you know, I've got my mind around that, but this radiation, I can't go there." And she said, will you consider it? And I said, "Well, I've considered it," and the answer is still no. And so during this time, I shared with her that this radiation fear is very deep-seated. And I said, this is not based upon, you know, a family member that I saw going through radiation, but it's more widespread than that. I trained in general surgery in the 1980s, and I saw many patients who had had pelvic and abdominal radiation, and it was not pretty. Many of them presented to us as general surgeons with bowel obstructions and terrible side effects. And I had one patient, this was actually when I was in practice, it was all done with my training, and I remember sitting on the edge of her hospital bed talking to her, and she was a young woman who had uterine cancer and had had her surgery in the past and had pelvic and abdominal radiation. And the reason she was seeing me as a general surgeon had nothing to do with her cancer coming back. It was because of those side effects of radiation. And she was talking to me, and she said to me, "Miss Mary, I don't care what happens to you in the future." She said, "Promise me you will never do pelvic or abdominal radiation." She said, "This is horrible." And I remember telling her, "Oh yeah, you've definitely shown me that I'm not going there." And so obviously time passes, you gain more experiences, but I had no favorable experiences to put on the side of balancing my aversion to radiation. I went and saw the two radiation oncologists, and both of them were very prepared for my visit. I'm sure Dr. McCluskey had prompted them, "You better be prepared for this one." And so they certainly knew all about my situation. They were both very informative. They presented positive options to me. And for the first time, someone, and both of them, had presented the option of IMRT. And so they just flipped those four little letters out like, "Oh, you know all about that." And I kind of, yes. I said, "I think that's intensity modulated radiation therapy." And they said, "Yes." And what that is, instead of just having a few beams of radiation blasting your entire abdomen or pelvis, we can control that. And so we'll have these little beamlets. We'll have about 9 of them that can focus in and have a much more focused type of radiation. And then we can spare the bowel, the bladder, and structures that we don't want to be blasting with radiation. And I thought, well, that sounds like a good idea. The decision to even consider any type of radiation therapy, as you can well understand, was a very difficult decision, but the combination of those two radiation oncology consultations within the space of a few days, and both of them confirming the benefits of IMRT, where they could have some focus to the radiation, and they weren't talking about this whole abdominal and pelvic blast, it started making sense to me. And I was acquainted with the concept of cyber knife and gamma knife, where it's very focused, but I was always used to that in the arena of neurosurgery and brain tumors. And mine was a little bit different than that. And so that concept wasn't really one that I felt translated here. And so when the two consultations both presented good information that IMRT was an option, the little aversion kind of started going away, and I stopped in to see Dr. McCluskey after the second consult, and I said, "Okay, you win." She goes, "You're going to do it?" I go, "Yes." And so it was kind of like I had given in but hadn't given up, and so she said, "Good for you."